International Symposium. The Future of Cervical Cancer Prevention and Treatment. 27 October 2024, Skopje, Republic of North Macedonia.
Use of adhesive slides and standardization of the conventional Pap test.
Ristovski Gligor, Isjanovski Filip, Ristovski Milcho.
Institutions. Point 1. Institute of Pathology. Medical Faculty, Skopje, SS Cyril and Methodius University, Republic of North Macedonia. Point 2. Private Gynecologic Clinic, Ultramedica, Skopje, Republic of North Macedonia. Point 3. Cytology Laboratory, PZU Sveti Mina, Skopje, RN Macedonia. Position. Despite the emergence of liquid-based protocols, molecular diagnostics, HPV detection, and immunohistochemical analyses, the conventional Pap test remains a key method for determining women's intimate health. It also plays a vital role in the early detection of cervical cancer by identifying both HPV-induced and HPV-independent intraepithelial lesions or other malignancies. Question: is the conventional Pap test becoming obsolete or, better yet, heading into retirement? Answer: in medicine, almost no diagnostic method, to this day, has achieved such a distinction. The Pap test has surpassed the status of a method that initially emerged only as a screening tool for malignancy. It offers insights into more than 150 normal and pathological conditions, which are not visible to the gynecologist's eye, nor to the new and expensive methodologies being promoted worldwide for reasons that are beyond the scope of this paper. Objective. The aim of this paper is to explore new directions and unified standards in the collection and diagnosis of conventional Pap tests, both from the gynecologist's and cytologist's perspectives. Materials and methods. The study used 400 stained slides from conventional Pap tests taken in private gynecological clinics across Macedonia, along with a database of patient information and follow-up data. Question: are 400 patients sufficient to draw conclusions? Answer: the data from the literature on similar studies indicate that they were conducted on either much larger or much smaller sample sizes. The slides were divided into two groups. Point 1. A group of slides taken using the current standard procedure, with traditional labeling, packaging, and transport methods. Point 2. A group of slides with smears applied on adhesive slides, pre-labeled with alcohol-resistant markings, fixed using either dry or spray fixation, mechanically protected, and transported in specialized containers, accompanied by new referral forms. The first group represents slides with the typical issues associated with the current procedure, while the second group consists of slides with avoided errors, high optical quality, improved adhesion, and a standardized procedure for smear collection, fixation, labeling, and transport, similar to blood sampling and analysis procedures. Question: what is adhesive glass in the context of the conventional Pap test? Answer: these are glasses also referred to as positive charge glasses and glasses treated with various coatings. The applied cells strongly adhere to the surface of the glass, do not fall off, do not require mandatory fixation, have high optical quality, and meet high standards for protecting the gynecologist and cytologist. They allow for unequivocal identification and help avoid contamination with cells from other patients during the old fixation, labeling, packaging, and contamination processes. We believe this represents a renaissance in the use of the conventional Pap test. The following parameters were statistically analyzed: the presence of material, monolayer smear, quality, adhesion capacity, fixation variations, optical transparency, nuclear and cytoplasmic, morphology, slide contamination, identification errors, mechanical protection, and the ease of sampling, packaging, and transport. Results. The results indicate that labeling and identification errors were completely avoided due to pre-labeled slides in the laboratory using alcohol-resistant markings, either manually or by printer. No slides were broken, there was no delay in fixation, and patients could take their material immediately after sampling without contamination. Dry fixation yielded identical results. Due to the adhesive nature of the slides, material loss was prevented, allowing for an objective evaluation of material presence, monolayer smears, and improved visibility of chromatin and cytoplasmic changes. The visibility of microbial flora was significantly enhanced, along with the detection of additional cellular and paracellular presence. The entire material was retained on the slide, and the unstained smear on the slide was suitable for molecular diagnostics, including HPV detection and typing. The processed, polished edges of the slides provided safety for both gynecologists and cytologists. In summary, the procedure offers a positive experience for the gynecologist, cytologist, and patient, resulting in a sense of diagnostic security. The cost of the second procedure remains relatively low and incomparable to other diagnostic methods. Question: what do the shown results indicate? Answer: it is necessary to change the current practice. Point 1. The existing checklists used as responses, or rather as results, should be modified and enriched with the possibility for descriptions, thereby avoiding many negative phenomena associated with the use of this inexpensive and often undervalued method. Point 2. The responsibility for the quality of the subject glasses should be noted or assumed by the laboratory where they are analyzed. Point 3. Fundamental changes are needed in educating women and doctors that the Pap test is not just a screening test for malignant diseases, but also a reflection of overall health and hygiene of women's intimacy in the sense of the reproductive organ that still shapes the world in an analog life. Conclusion: the results of this new, standardized procedure demonstrate the need to abandon many entrenched practices and completely revise the use, labeling, transport, and quality assurance of slides, mirroring the approach used in blood analysis. Each laboratory should handle and analyze samples with care and responsibility, using properly labeled and transported slide. Question: what are the prospects of these changes? Answer: the conventional Pap test, like an old soldier, equipped with modern technology, will continue to show its advantages in the future as long as the very expensive methods based on detecting pathological DNA methylation profiles do not come close to at least half of the Pap test selection potential. The differences in various comparisons and analyses often cited by other well-known and unknown authors, go beyond the scope of this paper. The work is based entirely on personal experiences, and for its conceptual inspiration, the authors have not found references from similar works.